Bismillahirrahmanirrahim. Every day you have a choice, stay the same or change. My topic of presentation is Acquired Human Deficiency Syndrome, AIDS. Learning outline. We will study introduction to AIDS, epidemiological triad, chain of transmission, levels of prevention, and recent advances. Learning outcome. At the end of the presentation, you will be able to describe epidemiological triad, prevention aspects, and recent advances. World AIDS Day is celebrated every year on 1st December, and in 2020, the theme was Global Solidarity and Shared Responsibility. Introduction. Acquired human deficiency syndrome is caused by human immunodeficiency virus, which breaks the immune system of the body. Problem statement. HIV continues to be a major global public health issue, having claimed almost 33 million lives. The area map on the right shows the global prevalence of the disease, and dark red and orange color shows high burden of diseases in country, and most of these countries are in Africa. At the end of 2019, 38 million people were living with AIDS, and out of those, 67% of them had access to antiretroviral therapy. Origin of AIDS. Scientists identified a type of chimpanzee in West Africa as a source of HIV infection in humans. They identify the simian immunodeficiency virus, SIV, which has striking resemblance to the human immunodeficiency virus. The earliest known case of infection with HIV-1 in a human was detected in a blood sample collected in 1959 from a man at Democratic Republic of the Congo in Africa. Now, UNAIDS and WHO has classified the HIV epidemics as low-level HIV epidemics, concentrated HIV epidemics, and generalized HIV epidemics. Now, discussing the details, in low-level epidemic, HIV prevalence among the high-risk groups is below 5%, and it is below 1% in general population. In concentrated epidemic, the HIV prevalence among high-risk groups exceeds 5%, but it is below 1% in the general population. And in generalized epidemic, HIV prevalence among general population exceeds 1%. Now discussing the scenario of Pakistan in 2019. Pakistan is in concentrated stage of epidemic. The prevalence of HIV in women aged 15 to 49 years is less than 0.1, and in men aged 15 to 49 years is 0.2. But prevalence is high in high risk group. It exceeds more than 5%. It is 20% in injecting drug users, 2% in sexual contacts of injecting drug users, and 3% in male sex workers, 0.6% in female sex workers, and 4% in transgender hijra sex workers. This is an area map of Pakistan showing the density of HIV cases per square kilometer, and there is a yellow spot in Sindh in Larkana, in which shows that the when testing was done, the seropositivity was 1 to 4.9%. Discussing the epidemiological triad of the disease, it includes agent, host, and the environment. Agent of this disease is human immunodeficiency virus, which is a retrovirus, and subgroup of this virus is lentivirus. Lenti means slow, so it is a slow replicating virus. It's RNA virus. It replicates actively in T4 lymphocytes, and it has unique ability to destroy helper T cells. And this virus mutates rapidly, and it is rapidly killed by heat. Even 60 to 85 degrees Celsius is sufficient to kill this virus. 20% ether, acetone, and 20% alcohol can also kill this virus, but virus is resistant to ionizing agents and UV light. Types of HIV. HIV is broadly classified into HIV-1 and HIV-2. HIV-1 is further subclasses include group P, O, N, M, and group HIV-2 is further classified into group from A to H. Reservoir of infection are the cases and the carriers. Source of infection. Virus has been found in greatest concentration in blood, semen, and CSF, and lower concentrations have been detected in tears, saliva, breast milk, urine, cervical, and vaginal secretions. Host factors. Discussing about the age group, all ages are susceptible, but this disease is more prevalent in 20 to 49 years. Genders, genders are susceptible, but in Pakistan, it is slightly more common in males. High risk group includes intravenous drug abusers, receiving unsafe injections, blood transfusion, and medical procedures that involve unsterile cutting or piercing, male homosexuals and bisexuals, heterosexual partners experiencing accidental needle stick injuries, including healthcare workers. Modes of transmission can be sexual transmission, blood contact, and blood is very contagious, and maternal to child transmission. Now we are going to discuss the levels of prevention, which include primary, secondary, and tertiary prevention. Primary prevention includes health promotion and specific protection. We can spread awareness about the disease, practice safe sex, sterilization of instruments used for cutting or piercing, no sharing of razors, injection syringes, and toothbrushes, and screening HIV in blood or blood products for the transfusion. In Pakistan, the donor blood is being screened for HIV before transfusion. Specific protection. Specific protection includes immunoprophylaxis and chemoprophylaxis. Immunoprophylaxis vaccination, there is no approved vaccination up till now because this virus mutates rapidly. Second, when this virus enters the body, antibodies are produced, but those antibodies are not capable of clearing the virus from the body. Still, work is being done on the vaccination, but up till now, there are no promising results from any vaccination company. And the specific protection includes chemoprophylaxis with antiretroviral therapy. Three types of chemoprophylaxis can be given: pre-exposure chemoprophylaxis, post-exposure, and preventing mother-to-child transfusion. Pre-exposure chemoprophylaxis is given in those who are at high risk, like sexual workers or IV drug abusers who share needles. In post-exposure prophylaxis can be given to healthcare workers when they are accidentally pricked by a needle with HIV, and we have to prevent mother-to-child transmission. Post-exposure prophylaxis, we are going to give first aid care to the patient. We are going to do counseling on basis of risk assessment. Ideally, the post-exposure prophylaxis should be started as early as possible and should be initiated within 72 hours. Tenofovir plus lamivudine is given for 28 days, and follow-up is done at 3 months with HIV testing. And if it is positive, then the person is referred for treatment. Vertical transmission. HIV can pass to offspring through placenta during pregnancy, during delivery, and by breastfeeding. And if no intervention is done, there is 20 to 25% chance of newborn that he will acquire the HIV. So, what can be done to prevent the vertical transmission? Antiretroviral therapies can be given, elective cesarean section before onset of labor or rupture of membranes, or refraining from breastfeeding. But in developing countries, cesarean section can bring a burden on the healthcare services, and contraindicating breastfeeding can cause burden, as in developing countries the under 5 mortality is high due to pneumonia and diarrhea. So breastfeeding is not contraindicated in these countries, and antiretroviral therapy is used, and this reduces the risk of transmission to 2% from 20 to 25%. Secondary prevention. AIDS is different in a sense that if a person acquires HIV infection, he or she remains infected for life. So we can diagnose the disease early, and prompt treatment can be done. Incubation period is from few months to 10 years or even more. Clinical manifestations are divided into three stages: acute infection, then a period of asymptomatic carrier state or clinical latency, and then AIDS related complex and AIDS. Acute infection occurs when the person just acquires the HIV virus. The symptoms of acute HIV infection include fever, chills, headache, night sweats, sore throat, muscle pains, joint pains, fatigue, swollen lymph nodes mainly on the neck, mouth ulcer. But many patients experience no symptoms. Then comes the asymptomatic carrier stage. There may be generalized lymphadenopathy, and stage is important because the person might not be aware that he or she has disease and is transmitting the infection to others. On the right side, there is a graph. On week 0, the primary HIV infection is acquired, and then the antibodies are formed from 2 weeks to 12 weeks. Even though viral load during this period is high, and screening tests for AIDS detect antibodies to the virus. So during this phase, there might be false negative result. AIDS related complex has illness caused by damage to immune system but without the opportunistic infections and cancers associated with AIDS. There may be unexplained diarrhea, mild infections like oral thrush, generalized lymphadenopathy, and enlarged spleen. Then comes the final stage of AIDS. It is a stage of opportunistic infections and cancers related with AIDS, and it is also known as slim disease. Now, on the right side, there are main symptoms of AIDS. Neurological symptoms may be encephalitis and meningitis, but these are more commonly to the HIV virus itself. It crosses the blood-brain barrier, and it is found in high concentration in CSF. And in lungs, there may be pneumocystis carinii, tuberculosis, and tumors. Skin, the tumors might be Kaposi sarcoma, and gastrointestinal symptoms may include esophagitis, chronic diarrhea, and tumors. Screening test of AIDS, as already discussed, relies on the antibodies to the virus. The screening test is ELISA, and sensitivity is 99.9%. Diagnostic test of AIDS is Western blot. Again, this test also detects antibodies to viral core protein P24 and envelope glycoprotein GP41. Both of these are diagnostic of the AIDS, and we can also do virus isolation, but it is very expensive and there is limited capacity and limited labs available globally. Treatment of AIDS. Treatment of AIDS is antiretroviral therapy or highly active antiretroviral therapy. uh, uh, as we know that once a person acquires HIV, he or she remains infected lifelong. Initially, previously, one drug was given, but as this virus mutates rapidly, now the three or more drugs are given for suppressing the virus. So it is known as highly active antiretroviral therapy, and there's no cutoff for starting AIDS treatment. When a person has infection, he or she should get the antiretroviral therapy according to the latest guidelines. Now, discussing about the drugs, there are they all of these prevent the replication of virus. Nucleoside reverse transcriptase inhibitors. HIV requires this in order to replicate. Non-nucleoside reverse transcriptase inhibitor. These inhibitors disable a key protein that HIV requires to replicate. Protease inhibitor. This inhibitor disables the protein called protease. Entry of fusion inhibitors. These inhibitors block the virus ability to enter the CD4 cells. And the integrase inhibitor, once the HIV has penetrated a CD4 cell, it inserts a material into the cells with assistance of a protein called integrase. The inhibitors block the virus ability to complete this crucial replication step. Now, first line antiretroviral therapy for adults, two nucleoside reverse transcriptase inhibitor plus one non-nucleoside reverse transcriptase inhibitor with or an integrase inhibitor is given. And then there is routine viral load monitoring at 6th month, 12th month, and then every 12 months. And treatment failure is considered when there are 100 copies of virus per ml after 6 months of treatment initiation. Second line drugs for adults. Two non-nucleoside reverse transcriptase inhibitors plus a protease inhibitor is given. Tertiary prevention. If the complications have occurred, we can treat them. HIV-related infections are treated with cotrimazole, and we can manage opportunistic infections and cancers related to HIV. Tuberculosis and AIDS. 16 to 27 times more likely to develop active tuberculosis infection. And tuberculin tests can be negative if the person is having AIDS because of decreased cell immunity in that patient. And there are problems with drug resistance of TB in AIDS patient. Now coming to the updates. UNAIDS has set a goal fast track ending the AIDS epidemic by 2030. Now, fast track targets. By 2030, the target is 95, 95, 95, which is that 95% of the population having HIV should know their status, 95% of them should receive treatment, and 95% of them should have viral suppression. And the incidence of new cases should be decreased to 2 lakhs globally per year, and there should be zero discrimination. By 2020, the target was 90, 90, 90, but by 2030, we have set it to 95, 95, 95. I have discussed this already. Now coming to the Sustainable Development Goals. Sustainable Development Goals, Good Health and Well-Being, target number 3.3, infectious diseases by 2030, end the epidemics of AIDS, tuberculosis, malaria, and neglected tropical diseases, and combat hepatitis, waterborne diseases, and other communicable diseases. Now, talking about the AIDS control program in Pakistan, interventions are done for high risk group, as in IV drug abusers. The prevalence is 20%, and establishment of second generation surveillance system has been established, and preventing HIV transmission to general public through blood or blood products. That why before transfusion, the donor blood is screened for the HIV, and treatment, care, and proper services for HIV and capacity building. But after devolution in 2011, the provincial AIDS control program in 4 provinces were developed and now are taking charge of HIV control in their respective provinces. Now, this is a picture of in the area map of Pakistan. There was an outbreak in Larkana. In this outbreak, 26,041 people were screened for HIV in Larkana district, Sindh province, and out of those, 2.9% were tested positive with HIV, and most of them were children. So 604 were children, 135 adults, and 12 age unknown between 25th April to 2nd June 2019. And 43.1% are currently being treated with antiretroviral therapy. Now, the causes are that there is unsafe, unhygienic practices like um, um, unsafe instruments for ear piercing in girls, and unsterilized circumcision blades in males, and other reuse of syringes by the healthcare quackery centers. These are the references of my presentation. Now it's time for the MCQs. Human immunodeficiency virus is a
Lentivirus.
Pakistan is in which stage of AIDS epidemic? Concentrated epidemic, generalized epidemic, low level epidemic, high level epidemic?
Concentrated epidemic.
Because in Pakistan, the prevalence is low in the general population, but in high risk groups like IV drug abusers, it's 20%. So it is a concentrated epidemic. Treatment of AIDS is started at CD4 count.
No cutoff.
No cutoff. 95-95-95 initiative is for
HIV AIDS.
HIV. Which of the following is the best strategy to prevent mother to newborn transmission in developing countries? Elective C-section, antiretroviral therapy, immunoglobulins to mother during pregnancy, contraindication in breastfeeding.
A.
It's the antiretroviral therapy, because the 3 therapies were elective C-section and contraindication of breastfeeding are not recommended in developing countries. So antiretroviral therapy reduces the risk to 2% of transmission. UN aims to end epidemic by 2030. Which of the following is the best screening test for AIDS? Antigen detection, antibody
Antibody
detection.
detection.
Theme of World AIDS Day 2020 was
A. Global
Global
solidarity.
Solidarity, Shared Responsibility. Which of the following disease is not included in Sustainable Development Goals for ending the epidemic by 2050?
Chickenpox.
HIV virus is killed rapidly by
0.5% alcohol.
its heat. It is 20% alcohol kills the virus, and heat, even 60 to 85 degrees Celsius, is sufficient to inactivate this virus. These are the keys. And
Thank you very much, Dr. Mehreen. It is a wonderful presentation. And would you please let us know more about the vertical transmission and how the zidovudine help the mother in decreasing the vertical transmission to the fetus?
Um, Ma'am, vertical transmission can be prevented by giving antiretroviral therapy to the pregnant females, and when the viral load is low, the transmission is reduced to 2%, and the transmission is dependent upon the viral load of the mother. So, in pre-pregnancy counseling, we aim to decrease the viral load.
Okay, thank you very much. And would you please elaborate about the WHO clinical criteria for AIDS? Sorry, I
Ma'am,
can't
sorry.
hear you. Would you please a little bit loud?
Ma'am, clinical staging system
Hello.
of HIV. Stage 1 is
Oh,
asymptomatic, and stage 2 is chronic latent period, and 3 is the development of AIDS.
very nice. I want to stress this point that HIV positive status, it is not equivalent to AIDS. HIV status may remain dormant because the virus remain dormant for years and years. So the AIDS is different, and HIV status of having positive result, it is something different. As Dr. Marian, you have told us that 99.9% sensitivity of the ELISA test for this HIV virus. So HIV virus, it must be uh, having the evaluation of with the clinical features. There should be correlation with the clinical features, especially the signs and symptoms, as you have correctly tell us about the minor criteria, major criteria, and you have also elaborated about WHO criteria of clinical features. So the HIV status, it is positive, and along with it, the AIDS should be defined on the clinical features like clinical signs and symptoms. Here, I would ask anybody if they have any questions, you are most welcome to ask. I would ask the participants, I would request the participants to please ask any question if you think that is relevant with today's presentation. Very well elaborated, well described, well organized presentation. Wonderful. Thank you very much. Allah Hafiz.